What is going on, and welcome back to another episode of I Coach Nutrition Radio. So based off a conversation that I had with a client earlier this week, we are going to dive into the topic of blood sugar management, and specifically what your doctor doesn't know about glucose testing. So without further ado, let's dive right into it. All right, so blood sugar management is important for preventing everything from hypoglycemia to full-blown diabetes. However, monitoring your blood glucose is rarely as straightforward as it seems. All right, and so what we're going to discuss here is essentially kind of the gold standard for measuring a person's blood sugar. We're also going to go into some common problems with some of the popular tests that are out there. And then from there, we'll kind of review over best ways to interpret your results, right? Even if your doctor doesn't know how, all right? So if we think about homeostasis, right? Homeostasis is essentially a fancy scientific word for body balance, right? And so essentially our bodies must keep internal levels of thousands of chemicals in check, or else health can go awry, right? So one of the most important homeostatic symptoms in our body is our blood sugar management system. And when blood sugar is kept at a healthy range, we feel healthy, we feel strong, we feel energetic. On the other hand, unbalanced blood sugars put us at risk for problems ranging from reactive hypoglycemia to insulin resistance to full-blown diabetes. All right. So estimating blood sugar levels can be, tricky, right? And this is why we have things like, blood sugar or blood glucose monitors, right? And this is something that I've done, myself. I typically do this during a dieting phase, and I also do this with clients quite a bit when they are trying to lose weight, because we want to make sure that their blood sugar levels, both fasted blood sugar levels as well as blood sugar levels after eating meals, is in line with where they should be. So these levels, they change throughout the day, right? They change with meals, they change with exercise. So unless you're monitoring your blood sugar levels continuously every second of every day, it's really hard to get a complete picture of what your glucose health looks like, right? And then second, the convenient glucose meters that many type 1 diabetics use only give us a snapshot, instead of a movie, if you will, right? They don't show us how people regulate blood sugars over time. And that may be the most important information of all when it comes to disease prevention, right? So this is why doctors and scientists have become obsessed with finding a test that measures blood glucose balance across days, weeks, or months. In other words, a test that will actually tell us about midterm and long-term glucose health versus a snapshot of what's happening right now at this minute, right? So while nobody's found the perfect test yet, there are two tests that are often used in medical practice today. And these are essentially kind of competing for the top position when it comes to measuring glucose health. So these two tests are what's called a glycated hemoglobin or hemoglobin A1C test. And then the other one there is a fructosamine test. All right, so both of these tests are very interesting in that they give a clear understanding of glucose levels over time, yet both have drawbacks that can get in the way of accurate diagnosis, especially in healthy people. All right, so let's kind of dive into this deeper. All right, so glycated hemoglobin or hemoglobin A1C test, as many of you probably reference that more so as, or hear that from your doctor more so as, allows doctors to essentially estimate a patient's average blood sugar levels across a period of several months, right? And so it's no wonder that A1C is often considered kind of the gold standard for evaluating glucose levels. More and more healthcare professionals, both conventional and alternative, are basing their diagnosis and treatment on the information they get from it. So let's kind of look at, all right, how does this hemoglobin A1C test actually work, right? So hemoglobin is a protein that's found inside of your red blood cells, and it carries oxygen from your lungs to all of the cells of your body. Okay. And so since red blood cells are always forming and dying, their typical lifespan is about 3 months. And this is important because when you eat glucose, sugar, right, it enters your red blood cells and it links up to glycates, which are the molecules of hemoglobin found inside. Okay. And so in the end, the more glucose in your blood, the more hemoglobin gets glycated, and vice versa, right? So by measuring the percentage of A1C in the blood, we can get an overview of our average blood glucose control for the past few months. All right, so this is when essentially A1C might not be accurate. All right, so if you test your hemoglobin A1C, essentially, well, let me back up here. So testing hemoglobin A1C sounds like a great idea, right? In theory. And indeed, the A1C test is very helpful for people already diagnosed with diabetes. But chronically high A1C levels predict greater risk for certain diabetic complications, such as what's it called? Retinopathy, right? Which is essentially what can potentially lead to blindness. Neuropathy is another one there, which this is something that possibly could lead to kidney failure. And then also, with neuropathy as well, essentially having problems with nerves, right? So the trouble is a couple of factors can falsely raise or decrease hemoglobin A1C, especially in healthy people, right? And this can essentially confuse practitioners and patients. So glucose regulation and A1C, right? So first, people with healthy blood sugar levels may have longer lived red blood cells than those with poor glucose regulation. So essentially, the better you regulate and manage glucose, the longer your red blood cells can survive. So the longer your red blood cells live, the higher your circulating hemoglobin, right? And if circulating hemoglobin is high, that will probably show up in the A1C blood panel. So in other words, to simplify this, it's possible for your hemoglobin A1Cs to appear a bit high, even, or maybe especially if your blood sugar regulation is excellent. And the opposite can also be true. So poor glycemic control may kill off red blood cells prematurely, and this can result in less circulating hemoglobin and a lower hemoglobin A1C measurement, even if your actual glucose levels are actually on the higher side, right? And so this is pretty ironic. So if you're feeling confused, right, it's kind of obvious, right? No wonder, right? This is one of those situations where being especially healthy can actually interfere with accurate assessment. And it's also why scientists are looking for better tests. So if we think about, how long do your red blood cells live? Well, if longer lived red blood cells can lead to higher hemoglobin A1C levels, despite healthy glucose levels, maybe doctors should be evaluating the lifespan and turnover of red blood cells in their patients, right? And so here's a calculation for doing that. It's just an estimation, right? But as blood chemistry calculations aren't perfect, still, it also, it essentially can give us a bit of insight into your personal red blood cell lifespan, and it offers food for thought. So to do this calculation, you'll need to know your reticulocyte count and your hematocrit. So reticulocytes are early red blood cells, right? These are produced in your bone marrow. They're released into circulation as reticulocytes, and in a few days transform into fully mature red blood cells. So reticulocytes can be used as a marker of red blood cell production. For example, in someone who is losing blood, for example, from a bleeding ulcer or heavy menstruation, or someone with short-lived red blood cells, the reticulocyte, essentially the reticulocyte count, it may be higher, right? And so this is because the body will attempt to increase red blood cell, it will attempt to increase blood cell production to make up for that loss. Okay. On the other hand, though, a low reticulocyte count can indicate that the body is generally happy with the amount of red blood cells or their lifespan, and it doesn't need to pump out as many reticulocytes. So the equation for determining how long your red blood cells are surviving is red blood cell survival in days equals 100, right? Reticulocytes to the percent divided by reticulocyte lifespan in days, right? So that's just kind of a tricky example there, or a tricky equation. Let's kind of apply this, right? So here's the actual example applied to like real life. So let's say your reticulocyte count is 0.8% and your hematocrit is 45. So pulling from a corrected reticulocyte count tables, account table, the number for the reticulocyte lifespan, or the RLS number as they reference it, would be 1.0. All right, so your equation would essentially be 100, right, divided by the absolute value of 0.8 divided by 1 equals 125 days. All right, so if your hemoglobin A1C number is a little higher than you'd expect given your current diet and lifestyle, and your red cell survival is longer than 120 days, your longer lived red blood cells may be the reason. Okay. So another important factor to kind of consider here is fat intake and A1C. So another factor that essentially, can affect hemoglobin A1C levels is the amount and type of fat you eat. So a recent study actually found that high saturated fat intake is associated with higher A1C levels through the authors. Well, in this study, the authors do kind of caution that we shouldn't draw any absolute conclusions from their findings. But there is another study as well that showed that similar correlations between fat intake and A1C levels, once again demonstrating that higher A1C levels were associated with greater saturated fat intake. Meanwhile, subjects who ate more polyunsaturated fat also had lower A1C levels. And then finally, there was a third study that suggested that hemoglobin A1C levels may be more affected by dietary saturated fat intake than by dietary carbohydrate or sugar intake. So in other words, the amount and type of fat you eat can also influence hemoglobin A1C levels, creating falsely elevated levels that might not reflect your actual glucose management. Okay, here's another one. High protein intake. So high protein intake in A1C. People with chronic kidney disease often have elevated hemoglobin A1C levels. And, we're actually not really sure why, right, from a research standpoint, but it may be because of their serum urea is higher, right? And so higher serum urea may increase glycation. And so people who eat a high protein diet can also have high serum urea. Though their levels are nowhere near as high as those with kidney disease, but still, if urea increases glycation, it is possible that a high protein diet could slightly increase hemoglobin A1C levels. Again, at this point, it's really just a theory. And to my knowledge, there's very few, if any, studies at all that have been evaluated that have evaluated protein intake on hemoglobin A1C levels. So really we'd need to do more research to know for sure. But nevertheless, it is worth kind of thinking about there. Okay, so what is urea, right? Urea is essentially, it's a colorless, odorless solid. It's highly soluble in water and practically non-toxic. So our bodies use it in many processes. The most notable is for nitrogen excretion. All right, so another piece that can influence A1C levels, antioxidant supplementation. So vitamin C, vitamin E, or coenzyme Q10 all may decrease hemoglobin A1C levels. Again, we need a lot more research to confirm or disconfirm these findings, but early research suggests there's a link. All right, another piece, anemia and A1C. So the effects of anemia on hemoglobin A1C are mixed. On the other hand, anything that leads to a shorter red blood cell lifespan, theoretically, could reduce a person's A1C levels. So people with untreated B12, folic acid, hemolytic or iron deficiency anemia might show artificially lowered A1C levels despite their glucose levels. Okay. On the other hand, right, iron deficiency anemia in particular can actually lead to higher levels of hemoglobin A1C. And this is because a compound called what is the word there? I'm blanking on the name of the compound there. I think it's called like dialdehyde or something like that. I'm pronouncing that wrong, but anyways, this compound can increase glycation as well. Okay, so let's kind of look at a summary of all of the possible interfering factors with hemoglobin A1C levels. All right, so in the end, again, this is just kind of a summary. of the main factors that could impact A1C levels and create kind of confusing and erroneous test results, right? So a high protein diet potentially could cause elevated serum urea, which could increase the A1C levels, right? Healthy glucose levels, because of longer lived red blood cells, could increase A1C levels. Iron deficiency anemia, because of increased glycation due to elevated the malodialdehyde compound. I'm pronouncing that wrong, but that could increase A1C levels. High saturated fat intake, vitamin C, vitamin E, and or CoQ10 supplementation well, actually, so let me back this up. So high protein diet, healthy glucose levels, iron deficiency anemia, and high saturated fat intake, those four could actually increase A1C levels. And then vitamin C, vitamin E, and or CoQ10 supplementation, as well as excess red blood cell breakdown, could actually decrease A1C levels. So trying not to complicate this too much, but essentially, does this mean that the hemoglobin A1C test is useless? No, absolutely not, right? When evaluating human physiology, the more data, the better. With many of these blood chemistry markers, the A1C test is definitely well worth looking at. It's probably one of the biggest indicators there relative to blood sugar. But you do need to take this, you need to take the results in context, right? If your levels appear a little higher than you expect, given your current diet, lifestyle, exercise program, then maybe you and your doctor should consider whether something other than faulty glucose regulation may be at play. For example, let's say you're following a paleo diet with relatively high amounts of protein and saturated fat. On testing, your hemoglobin A1C levels may be a little higher than expected. This reading may overestimate your actual glucose levels over the past few months. So what about other markers of glucose health, right? So doctors and researchers can also test fructosamine to evaluate glucose regulation over time, where the hemoglobin A1C test supposedly gives a picture of glucose levels over the past few months. Fructosamine levels give information about the past 2 or 3 weeks. So how this test works is like the hemoglobin A1C test, fructosamine testing also measures the amount of glycation, but this test considers a different protein called albumin. Okay, so albumin is the most abundant protein found in your bloodstream. It is produced in the liver and is said to exist for approximately 3 weeks before being broken down. So one study suggests that fructosamine is a better indicator of carbohydrate intake than the hemoglobin A1C test. And fructosamine testing can reveal as much about the possible long-term complications of diabetes as the hemoglobin A1C testing. That's one reason it's a little less popular with doctors. Yet it's useful in special situations like diabetic pregnancy or where a patient's diabetic treatment protocol is changed very quickly. So the fructosamine testing appears to be quite accurate. Still, it's not a perfect measure of glucose regulation, and here's why. So when the test can go wrong, first, albumin is a negative acute phase reactant, meaning it tends to go down during periods of inflammation or infection. Thus, people who are chronically sick often have lower levels of albumin, and this may falsely lower their fructosamine readings. So, kind of on a personal note here, if you will, at least half of the clients that register, or patients that register low normal albumin levels when they first arrive, at the doctor, especially from a female patient or client standpoint, dehydration can also affect those fructosamine levels. So this can lead to false positive results, showing that someone who has elevated glucose, someone that has elevated glucose, when in fact their glucose regulation is just fine. They just, they just need to drink more water. They just need to be hydrated. And then finally, high levels of vitamin C and hyperthyroidism can also complicate test results as well. So, what can you make of all this, right? If you are eating right, exercising, and following a healthy lifestyle, yet your glucose markers seem out of whack, don't assume that faulty glucose regulation is necessarily to blame. Instead, explore with your doctor whether other factors might be affecting your readings before jumping to the conclusion that you are a diabetic or pre-diabetic. Also, hemoglobin A1C and fructosamine tests are clinically useful and important markers, especially for those already diagnosed with diabetes. But again, in healthy people, they are far from perfect tests. So consider them in context and you will gain a clear picture of your overall health, along with a sure pathway to continued vitality. All right, guys, this sums up the blood sugar conversation here. As always, if you have any questions, please let me know. Drop them here below. And until next time, thanks, guys.